I'm Stanley Givens, and this is my beautiful wife, Martha Givens. I'm a radiation oncologist, a cancer specialist. I've been with Hendricks for 23 years. My connection to the ICU, which was unexpected, was when I became sick with COVID.
He was gasping for air, and I told him, I said, I'm going to put you in the car and I'm going to take you to the hospital, which was less than a mile away from our house. And what he said to me was, I need to go to the hospital, but I need to go to Hendricks.
I know many of the physicians here, I know the staff here, I know the quality of medical care here, and there was no question that I wanted to come here.
Stan made the phone call to Hendricks, and he was told, we'll have a wheelchair waiting for you. So even though we had not planned for that moment, Hendricks had. And when he arrived, they were ready. They took him to ICU. The one phone call that Stan did make to me from the hospital was to let me know that yes, he had COVID and that I did too.
I was in the ICU for about 2 weeks, and I was on the ventilator for 8 days. I remember actually when I came off the ventilator, someone said, "Happy Thanksgiving." And I said, well, what are you talking about? I know I've been here overnight. And they said, no, you've been here 8 days. And I said, no, are you sure? They said, we're sure. The thing that really stood out to me was the caring nature that everyone had. I felt the staff were incredibly dedicated, were working under very difficult circumstances. They were in their protective gear, very hot and uncomfortable, yet they kept working with smiles on their faces. And I never encountered anyone who wasn't pleasant, caring, helpful. It was incredible.
The hospital, the doctor, the caseworker, they were in touch with me every day. Someone would call me and let me know how he was doing.
Our family's faith is strong, and I don't know where we would be without our faith. One thing that really just touched me in the ICU, shortly after I came off the ventilator, a nurse came in. She asked me if I remembered her, and I said, I'm sorry, I don't. And she goes, well, you might have remembered my bad singing. Every time I've come in here, I would say a prayer and then sing to you. And that just floored me that someone I didn't even know, who had a lot of other things to do, would take the time to sing a little prayer, a little hymn. I know that the care that we got at Hendricks, the nurses, doctors, all the staff was obviously very important. But I also know that there's a higher power that certainly helped me through that as well. I think a new updated ICU will help Hendricks continue to be a leader in healthcare and providing very needed services to the community. Enlarge it, allow it to care for more patients and to care for patients in an even more sophisticated manner.
It is because of Hendricks and the work that is being done here that Stan is still here with us. We want to see others blessed in that way. There is a place of great comfort, expertise, and hope.
The care that I received here was just phenomenal, and I'm a testimony to great care because it's a miracle that I'm even here before you today. I just can't say enough thanks for everything that everyone did for me.
Stan and his wife represent the values of Hendricks Regional Health, represent who we are in the community, and Stan and his wife are a living testament to the amazing care that's provided and also the support we need in order to modernize and move this facility forward.